Did you know there is a blood emergency here in Western New York and also nationwide right now? We've talked about shortages before, but this has gotten quite serious. ConnectLife here locally tells us that there are a number of reasons behind the drop in donations, and COVID-19 tops that list.
Yeah, with so many people working remotely and concerns about spreading infection, far fewer people have gone out of their way this past year to donate blood. Not to mention, elective surgeries had to be rescheduled during the height of the pandemic. So another reason, in just the past few weeks, there's been an increase in traumas, accidents, and complex surgeries here in Western New York. And area hospitals report needing 20% more blood than usual.
Yeah, all of that coming together at the same time. And that's why right now there is a call to action. If you're eligible, you're asked to set some time aside and go donate just as soon as you can. Type O blood is most needed. It is, of course, the universal blood type and can go to anybody.
So in order to be eligible, you have to be 16 years old, at least 120 pounds and in good health, and you can donate if you've had COVID-19 or received a vaccine. Amanda Farrell with ConnectLife explains just how many people you can help.
Someone can donate whole blood every 56 days. So you could save up to 3 lives with every donation and donate up to 6 times a year. So you could save between 15 and 20 lives just with a few hours of your time. That's a really powerful thing to do and a really incredible gift you can give someone else.
Amanda told us that this is the worst and closest to an international blood crisis that anybody's ever seen.
And it is important to note there is no substitute for human blood. There's no synthetic product that can be made. Hospitals are 100% reliant on the generosity of regular people rolling up their sleeves to help others.
Yeah, so important. Finally for us here tonight, we seem to be on track for the FDA to soon give emergency use authorization for 12 to 15-year-olds to get the Pfizer vaccine. The government plans to ship the vaccine to 20,000 pharmacies across the country and will send it straight to pediatricians' offices so that all you'll have to do is visit your child's doctor.
So you may be wondering, what can those adolescents expect in terms of side effects from the vaccine? Gabe Cohen with our Verify team talked to the experts.
So let's verify. Could adolescents have the same reactions to the vaccine as adults? Our sources, Pfizer's trial results, a Moderna spokesperson, and an infectious disease expert. Pfizer tested their COVID vaccine on more than 1,100 kids aged 12 to 15, and early results showed 100% efficacy. In other words, none of them got COVID. But some of the kids had the same side effects adults are experiencing. Pfizer's results found that the vaccine was well tolerated in adolescents, with side effects generally consistent with those observed in participants 16 to 25 years old. Bear in mind, CDC data shows those young adults are far more likely to report side effects than older people, though the symptoms are similar across age groups: arm pain, fatigue, headaches, muscle and joint pain, chills, and fever.
They're gone within 48 hours.
Dr. William Schaffner is an infectious disease specialist at Vanderbilt University.
What we want to do is keep those side effects to a minimum, but still get protection.
The CDC says those side effects are normal signs that your body is building protection and should go away in a few days.
And they're much better than having your child be very, very sick in an intensive care unit.
I asked Moderna about the side effects of their vaccine on adolescents. They told me they don't have that data yet. We'll get much more data when Pfizer presents their results to the FDA's Vaccine Advisory Committee. And they hope to get vaccine approval for even younger kids later this year. But right now, we can verify, yes, kids 12 and up have reported similar minor vaccine side effects to adults. With your Verify, I'm Gabe Cohen.
All right, Gabe, good to know. Thank you. And thanks, everybody, for watching. We'll see you back here for another town hall tomorrow at 5:30.